Good day, I'm Dr. Paul Feldman, and next to me is Lori. Lori is 50 years old, and she's here for Sculptra. Sculptra is a long-term volumizer injectable, and it actually works different than all the other injectables in that it's more of a biostimulator rather than just a pure injectable. She will slowly and steadily build collagen and regain her own volume with the collagen, and it's like aging in reverse. I'm a plastic surgeon, and when patients come in for injectables or any other treatments, I like to give them an evaluation as sort of a value-added benefit. Lori was an example of somebody who came in originally thinking surgery, and I suggested injectables. And sometimes people come in with wanting injectables, and I'll suggest surgery. And I think the value that we bring is that we know what to do and when to do it. So if you look at Lori right now, actually her eyes are her eyebrows are in excellent position. She has good visibility of her upper eyelid, no real significant excess skin, just a little mild crinkling of her lower eyelids, but not an elongated lower eyelid. The real question, she's smiling a little bit and just being reposed, that she's lost a little volume to her mid-face here. Not a lot, and she's also had one prior treatment with Sculptra before. And actually she has a very good jawline, she has a good neckline, so she really doesn't need any sort of surgical correction. And we're going to add volume to the mid-face, which should actually puff up this area, and then by that way improve the nasolabial fold. Sculptra actually comes as a powder, and we reconstitute it or add water to it, or normal saline, and then we also add local anesthetic to it. So after we do the first injection, whatever sting that comes from the first injection is quickly relieved by the local anesthetic. Usually the first treatment I like to treat is the mid-face area. One of the facial nerves, the infraorbital nerve, starts in about this area. So even with the first injection, we'll numb that area almost like a dental block, and it makes the other ones even better. Almost totally corrected here. I think she has just a little bit of concavity here, just a small area, and I'm just going to treat just a little bit here. We just used about 1.5 cc's of Sculptra on Lori, and I think we've actually treated her to correction. I think that this is actually the look that we're going for. I added a little bit more just volume here, just to give it a little bit more definition. That we'll add over to here. We filled her out a little bit here, and then she had a little bit of hollowing there, and I think we filled that out. And I think one of the things is maybe not to try to over-treat. Now as we treat the opposite side, I don't use numbers per se to determine what the treatment is. I try to use an artistic eye to determine symmetry. Sculptra probably takes anywhere from 6 weeks to 12 weeks to get the full correction. So we're massaging the face, and basically we're massaging the areas that we treated with the Sculptra, and we're trying to disperse the product. Remember I said that we mixed it up with a water base that's really particles or a suspension of this powder, and we want to make sure that it doesn't clump up and leave a nodule. With the dilution that we use, that it would be a very rare event in itself. But we ask the patient to massage the face or the areas treated 5, 5, and 5. 5 times a day, 5 minutes each time, and for 5 days.
One of the reasons I wanted to have it done is I felt like right on my cheekbone that there was a little bit of crepiness, and I just wanted that filled in. And when I looked in the mirror, I really think that that has really gone away, at least at this point. We'll see a few weeks down the road what it looks like. But I'm happy with the results.